Hello friends, today we'll be discussing about microscopic vasoepididymostomy, that is MVE. Before starting, I would like to thank my junior and colleague Dr. Pulakesh for helping me uh, make these notes. So without further delay, let's get started. So microscopic vasoepididymostomy is a highly specialized microsurgery that aims to restore fertility in men with epididymal obstruction or blockage. So if there is epididymal obstruction, then this surgery will help. So here there is surgery which involves connecting the vas to the epididymis to allow sperm to pass through it and restoring the fertility. Apart from the normal regular investigations, that is the imagings, ultrasound and some of the blood tests, we have here is testis biopsy, which is necessary to confirm the normal sperm production when the blood FSH and testis size and anti-sperm antibody is negative. Other is vasography, which is generally rarely done but is sometimes useful to ensure there are no other sites of obstruction. Then the indications, so congenital anomalies, that is the absence of distal part of epididymis with absence of vas difference, Young syndrome. Then the infection or inflammation of the epididymis could be due to TB or chlamydia, iatrogenic injury during hydrocele surgery, orchidopexy or testis biopsy, after vasectomy or failed vasectomy reversal, epididymal cyst or tumor surgery. And it may not be indicated in patients with severe epididymal damage or scarring, poor sperm quality or quantity, active infection or inflammation, previous failed of similar surgeries. Now trying to understand the procedure in slight detail. So it's a complex procedure with high-end surgical skills with precision, and it is done under anesthesia and patient in supine position with small incision made in scrotum and testis is delivered. We carefully dissect and expose the epididymis, and vas is identified and prepared for anastomosis. Under operating microscope, the surgeon performed the anastomosis between the vas and the epididymis, and the high level of magnification of the microscopes helps to identify the tiny structure and perform the delicate suturing required for the anastomosis. If we have to write some more details, if we see some more details, the vas difference is exposed at the junction of the straight and the convoluted portion, and it is opened. Vasal fluid is sampled, and if there is presence of sperm in the vasal fluid, it signifies that there is proximal vasal or ejaculatory duct obstruction, and a vasogram can be performed. If there is no sperm in the vasal fluid, that means there is a epididymal obstruction. So sometimes there is copious amount of clear fluid without sperm that is encountered. So if there is no clear site of epididymal obstruction, a vasovasostomy should be performed considering a obstruction in the vasa or the ejaculatory duct. So here the tunica vaginalis is incised and the testis is delivered for epididymostomy. The epididymis is carefully visualized and palpated, often a granuloma or area of induration above which the dilated tubules is present. The incision and exposure for vasa epididymostomy proceeds similarly to the vasovasostomy, and it is performed to bypass the site of epididymal obstruction. So what are the surgical challenges? So delicate blood vessels, vas and epididymis vessels are fragile and prone to damage, resulting in failure of surgery. Sperm granuloma, which is due to sperm leak from the anastomotic site. Anastomotic failure, the connection between vas deferens and epididymis may fail, leading to obstruction. And scarring and adhesion of due to previous surgery and infection may cause scarring and adhesion, resulting in the procedure to be more challenging. and anastomotic failure, as we have discussed, due to failure of anastomosis resulting in obstruction. Outcomes. So success may be depending on the individual factor such as the location, severity of obstruction, patient age, sperm quality. Pregnancy may range from 20 to 50% per year, with some studies reporting higher success rates. Regular follow-up with seminal analysis to evaluate the sperm quality and quantity. Complication for sperm granuloma, infection or failure. Fertility outcomes to track pregnancy rates and fertility success. So at last, to conclude that this is a highly specialized procedure, the microscopic vasoepididymostomy, which offers hope for men with epididymal blockage or obstruction, and it helps in restoring the fertility. And we should remember that careful patient selection, evaluation, meticulous technique for surgery, and thorough follow-up is essential for the best outcomes. So this was all about microscopic vasoepididymostomy, which is asked as a short note in DNB and MS exams. Also, it was also asked in MCH DNB exams. So please like, share, and subscribe if you have found the video useful. And keep studying, keep growing. Thank you for watching. Never give up because great things take time. See you in next video soon. Thank you.